again to the Medical Terminology Podcast. This episode is Chapter 12, Part 3, Skin Lesions 2, Skin Growths. We're going to continue our focus on skin lesions. In the first part, we're going to talk about harmless skin growths, and in the second part, we'll cover the skin cancers. First of all, skin growths are formed from skin cells that have multiplied. And we have a general medical term for any kind of skin growth. That term is keratosis. Keratosis. Keratosis, general term for any skin growth. The second term is a common term, and that is callus. Callus. Callus is a thickening on the part of the skin due to repeated rubbing. And most all of us are familiar with this if we've been out working in the yard with a hoe or a shovel and our hands get worn and scraped and rubbed, we'll develop calluses on them. Or we might get a callus on a foot from walking too much. The next term is granulation tissue. Granulation. Granulation tissue refers to tissue that normally forms during healing of a wound. This, of course, is a kind of skin growth that we want to have. If we have a wound or an injury, we want the skin to grow back. That normal tissue that grows back is called granulation tissue. A related term is granuloma. Granuloma. As you should remember, oma refers to tumor or growth, and a granuloma is a small knot-like swelling of granulation tissue. It's like literally a tumor of granulation tissue. Well, when we have a wound that's healed over with granulation tissue, sometimes we can have a scar left over. And the medical term for a scar is a cicatrix. 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 That's the medical term for a scar. And finally, we can sometimes have scars that are rather large, raised up, or thickened. And the term for an abnormally raised or thickened scar is a keloid. Keloid. Well, let's go back and review. What is the general term for any skin growth? That's a keratosis. Keratosis. What is the term for the tissue that normally forms during the healing of a wound? That's the granulation tissue. Granulation tissue. What is the medical term for a scar? That's cicatrix. Cicatrix. What is the medical term for an abnormally raised or thickened scar? That's the keloid. Keloid. And what is the term for a small, knot-like swelling of granulation tissue? That's granuloma. Granuloma. And again, you'll notice these four terms here are all related to scarring or healing of wounds. So it's really a good idea to get those four together in your mind. And finally, we have the term, that's a common term, but also a medical term, for the thickening of part of the skin due to repeated rubbing. That's the callus. Callus. Okay, and I have a few more terms for you related to skin growths. We have a general term for a mushroom-like growth that can be on the surface of a mucous membrane, and that's the polyp, P-O-L-Y-P, polyp. A related term is skin tag, S-K-I-N-T-A-G. A skin tag is a small polyp that hangs from the body by a fine stalk. And then we have three terms for tumors that are not malignant. They're benign, meaning that they are not harmful. And the first one is a lipoma, L-I-P-O-M-A. The word part should tell you what this one is. Lipo, L-I-P/O, and oma, hyphen O-M-A. That is going to be what? Well, I hope you got fat tumor or fatty tumor. And the important thing is this is benign and slow growing. It is not dangerous. Lipoma, fatty tumor. Then we have papilloma, P-A-P-I-L-L-O-M-A. A papilloma is a benign wart-like growth. And finally, we have the medical term for a mole. And this would be a type of mole that is benign, it is not dangerous. And the medical term for a mole is a nevi, N-E-V-I. And one thing to consider is that a mole is also a type of skin discoloration. And a nevi would be an example of what? What is the larger term that refers to any flat skin discoloration? Well, I hope you remembered that's a macule, M-A-C-U-L-E, and a nevi or a mole is an example of a macule. Okay, let's go ahead and do some practice over these terms related to skin growth. Number 1, what is the medical term for any skin growth in which there's an overgrowth or thickening of the skin? Well, that's keratosis, K-E-R-A-T-O-S-I-S. Any skin growth is a keratosis. What is the term for a benign, slow-growing fatty tumor? That's a lipoma, L-I-P-O-M-A. What is the term for any tissue that normally forms during the healing of a wound? That's the granulation tissue, Granulation, tissue. What is the medical term for a scar? That again is the cicatrix, Cicatrix. And what is the medical term for an abnormally raised or thickened scar? That's the keloid, Keloid. What is the medical term for a mole? Nevi, Nevi. What is the term for a mushroom-like growth from the surface of a mucous membrane? That's a polyp, Polyp. What is the general term for any small, knot-like swelling of granulation tissue? That's the granuloma. And a thickening of the skin caused by repeated rubbing, such as if you're working outdoors with your hands, is known as what? That's the callus, Callus. And finally, what is the term for a benign, wart-like growth? That's a papilloma. Papilloma. Okay, part 2, skin cancers. Well, skin cancer is a harmful or malignant growth on the skin. We have a general term for any type of precancerous skin growth that can occur on sun-damaged skin, and that is actinic keratosis. Actinic, and then keratosis. Keratosis. And remember again, what does keratosis refer to? Well, that's any skin growth, right? So actinic keratosis is a type of skin growth that is, again, precancerous. And then there are 3 types of skin cancer that are discussed in the chapter that we have terms for. The first one is basal cell carcinoma, BASAL, cell, CELL, and carcinoma, CARCINOMA. Basal cell carcinoma is a malignant tumor of the basal cell layer of the epidermis. And there are a couple facts about this that you should know. First, this is the most common and the least harmful form of skin cancer. And second, the lesions are pink, smooth, raised, with a depression in the center, and they tend to bleed easily. The second type of skin cancer is squamous cell carcinoma, SQUAMOUS, cell, CELL, and carcinoma, CARCINOMA. As the term suggests, this is a tumor in the squamous cells of the epithelium. A couple of facts. This type of cancer can spread quickly to other body systems, so it's more serious than the basal cell carcinoma. The lesions are sores that will not heal or that have a crusted look. And finally, we have malignant melanoma, MALIGNANT, melanoma, MELANOMA. And this is a malignant tumor in the melanocytes. And do you remember what the melanocytes are? Well, these are the cells that produce melanin. Melanin is the pigment that gives skin its darkness, makes skin dark. Those with very dark complexions have a lot of melanocytes, a lot of melanin. Those with lighter skin tone have fewer melanocytes, they have less melanin. Well, malignant melanoma is the least common but the most serious form of skin cancer. The lesions are moles that have changed color or shape, and there's an important means of identifying melanoma lesions. We have the mnemonic A, B, C, D. These signs to look for are first asymmetry, ASYMMETRY, meaning that the shape is not symmetrical all the way around. If something's symmetrical, you can fold it in the middle and it's the same on both sides. The second thing to look for is border, BORDER. Malignant lesions have irregular borders. Color, COLOR. Malignant lesion is going to have irregular color. It's going to be two-toned. And finally, diameter, DIMETER. If a mole is larger than a pencil eraser, it could be a cause for concern. Okay, and now let's practice or review these terms related to skin cancer. What is the term for the least harmful type of skin cancer? The least harmful type of skin cancer, but also the most common, is basal cell carcinoma. BASAL cell carcinoma, CARCINOMA. What is the term for a precancerous lesion? That's actinic keratosis. ACTINIC keratosis, KERATOSIS. The most serious form of skin cancer is known as what? Well, that's the malignant melanoma. MALIGNANT, melanoma, MELANOMA. What is the term for the skin cancer of the upper layer of the epidermis? That's the squamous cell carcinoma. SQUAMOUS cell carcinoma, CARCINOMA. Remember, the squamous layer is the upper layer of the epidermis, whereas the basal layer is the lower layer of the epidermis. And finally, what are the 4 signs that can help identify malignant melanoma? Well, that's the ABCD: asymmetry, border, color, and diameter. Okay, that covers the skin growths. In the next episode, we're going to go on and cover a third set of skin lesions. Again, I hope that you've mastered the first group, the surface and fluid-filled lesions. Now you should go on and master the skin growths before you go on and do the next group. This ends this episode of the Medical Terminology Podcast.